Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Syndrome of inappropriate ADH secretion. The most common cause of syndrome of inappropriate ADH secretion is head injury is the most common cause of syndrome of inappropriate ADH secretion. Then volume overload will also result in this secretion. Whenever there is volume overload, there occurs dilutional hyponatremia will occur, and this will also result in SIADH. There are many different causes of SIADH, but right now in pharmacology we are interested in the treatment of SIADH. The treatment of SIADH is because in SIADH there is increased amounts of volume overload in our body. First we will have to restrict the fluid intake. This is actually the treatment of choice for syndrome of inappropriate ADH. Then in order to cause the excretion of water, we give furosemide with 3% saline is given for acute treatment. Mainly we give furosemide with 3% saline. The drug of choice for prophylaxis of this SIADH, we can give ADH antagonists can also be given, especially Vaptan group. In the Vaptan group, we can give drugs like conivaptan can be given. This conivaptan is actually a non-specific inhibitor of V1 receptor. That means it will inhibit both, it will act on both V1 and V2 receptors, so it will block both V1 and V2 receptors. Then that is conivaptan. Then we also have tolvaptan, and uh, tolvaptan is actually a specific inhibitor, so it can also be given. Then we have demeclocycline can also be used. Lithium also inhibits ADH activity, so it can also be used, but this lithium is not used mainly because of its toxicity. This lithium is not used. Then dimethylcycline and lithium are also ADH antagonists. They can be used, but lithium is not used due to toxicity. And even drugs like we have alcohol, other things like alcohol will also inhibit ADH, but we should not use it as therapeutically. Then we have felipressin. Felipressin is a drug which will prolong the action of local anesthetics. It will prolong the action of local anesthetics.
thank you and thank you for watching.